Hello everyone, today I will discuss about how to prepare for your NHS interview, and I will talk you through about the steps that you need to take in order to crack on and get the best out of it. Let's say that you take your interview as a learning opportunity and make best use of this this step in order to improve yourself clinically as well as in terms of presentation. I want to break my talk in four steps how to get you step-by-step guide in order to prepare best for the interview. So the first thing is that you need to know your job role very thoroughly. You need to know what you're applying for and what would be your responsibilities and how you can relate your present position to the job that you have applied for. Second thing is that you need to know the framework of the interview. The NHS job interview for doctors are pretty much standard, and most of the trust or most of the time you will encounter the same question in one type or the other, and I will give you detailed examples of how these questions are framed. The third thing is that after you have thoroughly searched your role and you know what are the framework of the interview, you need to generate some homework for yourself, and you need to actually go back and read from the clinical and OSCE books that what you need to know about XYZ clinical condition. You might need to go to your senior colleagues to say that I haven't experienced this complication or this situation of this common clinical presentation, and if that is the case, what are the key points I need to stress on. Fourth thing is that it is also valuable to speak to any other candidates who have been through the same situation. If they have been interviewed in the same trust, or they have been interviewed in the same country, or anything that you can relate to. So the most important thing is that you need to know what role you're applying for and how does it relate to your present clinical and practice condition. In order to understand that, to briefly I would summarize how NHS hierarchy of doctors work. So you have doctors in three grades. First grade are the tier 1 doctors, which are the junior doctors. They are senior house officers as well as foundation trainees, and ST1 doctors, which are the specialty training 1 doctors. Then we move on to the middle grade doctors or tier 2 doctors. These include more experienced in the relevant field and the doctors who are in specialty training register and who have completed their MRCP or MRCP-CH. Third tier is of course the consultant, who are responsible for their independent management and responsibilities. Talking about your tier 1 doctors, senior house officers and foundation program doctors. Foundation program doctors are not yet fully GMC registered, so these doctors still need more support whenever they are practicing, and they share the same rota as ST1, but we make sure that their shifts are more covered and they are more supported. Then are the ST1 or senior house officers. So you are expected to to have more confidence in dealing with common clinical situations, in clerking, in routine procedures, in routine day-to-day work, and then flag it up to the seniors whenever is needed. Second category is the tier 2 registrars. The registrars are basically your basically backbone of the rota. They are in intermediate connection between the consultant and the SHOs, and they're mostly responsible to answer the crash bleeps, to assess the clinical situation, provide the emergency management, make decision on admission and discharge, and then flag it up to the other team or the consultant whenever needed. The consultant, they work independently and they're responsible for managing the team. They usually cover 9 to 5 every day, and also some extended hours. They stay till 10 o'clock, and then most of the time they are on call from home during the night. In certain specialties like in neonates or in tertiary says, they might be in-house consultant as well. Knowing this basic structure of NHS doctors, rota and hierarchy helps you to understand where your job responsibilities will be shared and how you are expected to function at what level and what independence. So whenever you're reading your job description, make sure that you are aware of which ST level, tier 1 or tier 2 levels you are applying for, and what are the expectation Also, it is worthwhile to know some basic understanding of the trust. You can always call the admin and ask for like what kind of rota. Usually they have how many junior doctors and how many middle grades they are, or how the rota rotates in 8 weeks or 6 weeks pattern, which gives you a rough idea of what is the length and width of the practices. Usually in general care hospitals, the rota is well supported. Your 9 to 5 you are provided with more members of the team. However, on calls the numbers of the doctors are quite slim, and you are responsible for doing more independent and responsible work. If you see this page, it clearly defines what are the terminology and how they are classified and what level of responsibilities they have. Now and again, I'm emphasizing on to know your job details correctly, and also have some basic understanding of the trust that you're applying, and also know some core values of the trust, which makes them a bit different because some trusts are more known to certain specialties or certain level of care they provide, or certain values that they possess. So it's always a good idea to go to the home page and search their values. Right, now coming back to the framework of interview, most exciting bit and more scary bit, right? So I would say that NHS interview is pretty standard. They don't want to dodge you, they don't want to make you nervous, or they don't want to trick you. They want an honest answer, and they want an actual reflection of what your capabilities are. Your CV is with them, and they know which country you are from, which job you have applied for, but actually the interview gives them an insight of knowing you personally. So I guess make this opportunity worthwhile and make it in your interest the best opportunity to convince them that yes, you have had this experience and you are ready to take that job and all the responsibilities which comes with that. Starting with the NHS interview, first question usually asks about either to introduce yourself, or take us through your CV, or summarize your clinical experience, or how your clinical experience relates to the job you have applied for. All of these questions, they basically ask you to present yourself or summarize yourself in a nutshell, that how far you have achieved, how far you have developed yourself as a doctor, and what are your current level of practices, and what responsibilities you can handle. The second part is always about the clinical scenarios. First of all, they might ask you with a simple clinical scenario where the patient doesn't need admission, would need a good thorough investigation, a thorough revision of the history of knowing what it has caused, like abdominal pain, which is very non-specific, not related to any acute abdomen, and you can safety net them and send them home. Or the second part of the clinical scenario will be more acute presentations like asthma, DKA, seizures, etc., and it changes with which specialty you're applying for. So always make sure that you are aware of the most clinical presentations, and how do you have this ABCD approach. The fourth part of the interview is about the GMC ethical scenarios. They will deal with working with a difficult colleague, a difficult communication, a prescription error, a difficult situation anytime relating to non-medical side of the things, how you would manage. So these are quite variable, and they are quite situational, and they actually test you how honest you are and how are your abilities to escalate, because GMC expects a doctor to be very honest and keep patient safety as the first priority. Fourth part of the interview is about the extended bits like your audit, your quality improvement projects, your research, your academic interests. So you would be asked, and you can directly answer what projects you have been involved, or if you have not done a full audit cycle or a full research project, you can just relate to what bits of your practice actually reflect that you're working towards the quality improvement and clinical governance. It is also called clinical governance because it's it's a huge term which implies to what actually we do as a non-medical side of the things in management to improve patient care and quality. So I'm planning to make a series of videos in which will actually involve how you respond to these questions. So I have spoken to a few consultants and made an ideal answers of what you will expect to answer in introduction, in clinical scenarios, in ethical issues, and in your quality improvement or your clinical governance questions. So that will be an interesting bit to stay tuned to. Coming back to generating yourself homework, it's a very important task, because sometimes you won't be exposed to each and every clinical scenario, or even if you are exposed to a clinical scenario, maybe the bit that you managed was not continued till the end by you, and it was taken over, the shift changed and the patient was transferred to another hospital or to another ward, so you were not able to actually follow through what happened, which actually can create a bit of a gap in your knowledge and practice. So make sure that you make a list of common clinical situations and what are the important most important clinical management steps that you need to know. For example, in DKA you should be very meticulous in fluid and insulin balance and electrolytes, and basically monitoring and what exactly you need to do. In asthma you need to be very on top of nebulizations and bronchodilators and IV therapy. In MI you should follow what your exact protocols are, because these questions basically reflect kind of your instinct, and unless you have not been to the situation, it's difficult to answer. Also, if you have not been directly to the situation, it's helpful that you create a situation for yourself, go back and read from clinical exam OSCE books, and also discuss with your seniors, because sometimes the OSCE books can give you a different setup, the answers which are from different setup, from different resource, in a sense that if you have different kind of insulin in your department, in your hospital, which works in a different way, or you make infusions differently, it can actually impact your answers. So make sure that you actually have truthful management tips that may make a difference in the clinical management. Finally, speak to previous interviewees, whoever are the doctors you can find on online platforms who have been through the same situation. Either they have been interviewed from the same trust, same specialty, or same country. It is a big advantage that when you cross-talk and you understand your gaps, because this gives you a direct kind of first-hand information. And whatever I have experienced, the NHS interview questions, they don't change. It's more understanding the gaps and making sure that you present yourself as a responsible, honest and truthful doctor, and you approach it as professionally and take it as a task or assessment, just like as you do with your other clinical exams. I hope this basic framework has helped you, and the next following videos I will give you the ideal answers for each and every question. Thank you very much for watching. Thank you. Bye.